We're so happy that you've joined us today. We're celebrating a very important anniversary. It's the 10th anniversary of this event. We've done this for a decade. I want to recognize Susan Silverman, who was the founding chair of the Breakfast Club. Our current chairs, Beth Nadell, Carol Rubin, and Sue Ellen Freeman, and the wonderful, wonderful committee members who have made this such a successful venture. We're going to hear from our CEO, Warren Geller, who couldn't be with us today, but he wanted to share his thoughts. So we're going to see a little video.
Over the last decade, I have seen Englewood Health transform from a small community hospital to a nationally recognized health system. And our reputation as the place to turn to for personalized, patient-centered care has grown exponentially, thanks to our team members and their underlying commitment to excellence and compassion. I learned early on in my tenure at Englewood Health that our best marketing came by way of friends and neighbors who were happy to share their experience with others. So when the Breakfast Club was launched, I thought, what could be better than a chance to sit with friends to learn more about Englewood Health? Well, that was 10 years ago. Today, the Breakfast Club stands as one of our most recognizable community events and draws sustained support from donors year after year. I want to thank from the bottom of my heart Susan Silverman, Beth Nadell, Sue Ellen Freeman, and Carol Rubin for their ingenuity and foresight. As co-founders of the Breakfast Club, they helped build an incredible resource that gives participants an opportunity to connect with our team and hear about the incredible work happening throughout the health system while raising funds to support many of our award-winning clinical programs. I would also like to thank the members of the Breakfast Club Committee for all of their support, personally and professionally, throughout the years. On behalf of all of your friends at Englewood Health, congratulations on this milestone anniversary. Thank you to all of our friends and donors in the Breakfast Club. I am confident that in the not-so-distant future, we will be celebrating happy times together in person with smiles visible.
Congratulations, everyone, and thank you to all of our supporters. We're here today to talk about a very serious topic, the mental health crisis in our country. We have an esteemed panel assembled, Dr. Jennifer Ashton, ABC News Chief Medical Correspondent, Good Morning America, Valerie Vainiere Huttle, who's our Assemblywoman, 37th District, Dr. Brunnquell, Stephen Brunnquell, who's the president of the Englewood Physician Health Network, and Pat Shadek, who is the chair of the Shadek Center Advisory Council. There's going to be time for you to ask questions and to participate in this discussion. And the way to do that is to use the Ask the Question feature. And we're going to be happy to do that toward the end of the discussion. So I'm going to begin with Dr. Ashton. You are a leader, a medical leader, resource for so many people across this country every day, a trusted resource. What are you seeing and what are you hearing about mental health and with the COVID, with the implications of COVID? What are you hearing from people?
Well, first of all, thank you so much for inviting me back. This is my second time with the Breakfast Club, and really honored to be on this incredible panel. And thank you for your kind introduction, although you left out one of my titles that I'm probably most proud of, which is on-staff attending physician at Englewood Health for 16 years now, I think. My private practice is in Englewood. It will always be in Englewood, and no matter how busy I get reporting on national news stories, and certainly this pandemic this year has been unlike anything we've ever seen, my medical home will always be at Englewood Health. So it's a real pleasure to be with all of you again. I think, this is probably not a surprise to many people, but we're learning more and more about the profound effect on our mental health that this pandemic has taken. Just today, there were yet more peer review articles in the medical literature about increase in overdose deaths since the pandemic, skyrocketing rates of depression, anxiety, particularly amongst young adults. As I just alluded to, you know, my private practice is in Englewood. I see patients twice a week, and not a single patient who has been in my office since we reopened in the beginning of June has not told me that they are feeling the psychological effects of this pandemic. So I think that part of what hopefully we're going to do today in this conversation is normalize, recognize, acknowledge how ubiquitous this is. And when I say normalize it, I think that is the first step in clinical medicine. Dr. Brunnquell and I know this very well, but you make your first step by observing. And when you observe something, then you ask yourself, is this rare or is this common? And I think that the psychological effects of this pandemic are not just common, they're across the board. And I think that it would actually be abnormal for someone not to be feeling the effects of this, whether it's the psychological wariness of the pandemic fatigue in terms of our behaviors, or whether it is an increase in anxiety, depression, mood disorders, feelings of loneliness and isolation, all of the above, you know, being felt by all ages. Of course, some groups a lot worse than others. And in particular, healthcare workers are absolutely suffering true PTSD. They have never seen anything like this, of this magnitude, of this time. You know, we go back to major disasters that we've all experienced in our lifetimes. 9/11, it was one day. There was a beginning, there was a middle, and there was an end, and then you started to recover. There is no end in sight. This has been going on in some way, shape, or form since January. And there will be effects, short-term and long-term, for sure.
I'm going to pick up on that. Dr. Brunnquell, you want to talk a little bit about the PSTD or how this is impacting our healthcare frontline workers?
Right, Debra. So Dr. Ashton's absolutely correct. And our healthcare workers, particularly with what we went through in the spring, which was clearly it was devastating. As you all know, the hospital essentially shut down except for true emergencies. Virtually the entire house was COVID. That's when we didn't know about the virus. We were literally teaching each other as we went along. We didn't know in the beginning. I know many people were critical because recommendations and guidelines changed and evolved. They changed and evolved because we were learning about a brand new disease for which there was no chapter in the textbook and there was no lecture in medical school. I got on the phone every day with the other chief medical officers in Bergen County, and we shared what we were seeing, and we taught each other. We realized that people were clotting and having strokes and heart attacks long before anybody published this, and we put in our own protocols. But in doing so, throughout the spring, people were crashing in front of our eyes. People would come into the emergency room relatively stable and be very, very sick and on a ventilator within hours. We've never seen anything like it. And this will have a lasting effect on all of us. And so the hospital has made a considerable response to this in terms of a 24/7 hotline for employees, in terms of our mental health professionals being available to them. Back in the spring, even our voluntary docs and some of our retired psychiatrists made themselves available for our staff. We have ongoing support groups. We have online resources for our staff. I'm very concerned about what happens as we go forward. I share with people that in the spring, there was this huge surge of adrenaline. Like, we can do this. We're all in this together. Let's do this together. And now we're doing everything that we need to do, but there's no adrenaline. There's just no adrenaline left. It's people are being taken care of, and we're discharging faster than we did before, and people are getting better faster, and we have fewer people on ventilators, but you can feel the emotional toll on the staff.
Dr. Ashton, can you talk a little bit about what you're seeing, about how symptoms are being manifested? Alcoholism, depression, anxiety. How is all of this playing out? In addition to increased numbers based on the pandemic.
Well, first, we have to look at, for example, stories that we've featured nationally at ABC Network, because remember, again, this is national network. It's not local. And of course, yes, back in the spring, the local news was the national news, right? But since then, a lot has come out about, and I think it's helpful to think of it by age group. And again, no age group is immune from the psychological and psychosocial effects of this pandemic. None. So when you look at, let's say, let's start with the most vulnerable, the elderly. We have reported on, and this has been published in peer-reviewed literature, and it's been covered in media, and I have seen it firsthand, not just in my family with my parents, but my patients. Everyone knows someone, right? This is, first of all, many people in our community. I have five patients who lost both elderly parents to COVID. That's staggering, right? And before, Valerie was saying that she's noticed on the government level that a lot of people, even within our state, don't believe how real this is. Well, it doesn't take more than one person who's lost a loved one to drive that point home, right? But when you talk about the elderly, this is a demographic for whom already their social interaction circle is shrinking for most people. And so then you bubble them, you put a cocoon around them to protect their health, their physical health from COVID, and immediately touch, hugging, holding hands, interacting with other generations, even in some cases, their caregivers. That was absolutely amputated. The fear factor, my own mother, who's a retired nurse, 81 years old, said early on in the spring, you know what, if this is how I go out, this is how I go out, but I'm seeing my grandchildren. And that's not an uncommon reaction to people. So that we've seen some profound mental health effects on older people. Then you take middle-aged people, that sandwich generation, also used to being with people, whether it's at their job. I've spoken to people both in my practice and in my capacity at ABC whose jobs, now everyone's saying, well, work from home, isn't that great? Not really. I mean, yeah, people are happy they have employment because many don't, but when we didn't ever realize that part of going to work was the social interaction that we found with our colleagues and coworkers at our workplaces. Gone, right? Or changed in some cases permanently. Then you talk about the younger generation. I have a 21-year-old, 22-year-old who didn't have a college graduation, now is lucky enough to have a job, has had some major psychological effects of this pandemic. He said to me, Mom, at 22, I should be, going out, socializing, meeting people, dating, enjoying the fact that I just graduated college and have a job. Nope, working from home, isolated. And then you talk about younger children. I always say to people, and I've said this on the air, a year for a 10-year-old or even a 20-year-old, that's like puppy years. For us, a year, okay, it's a year. A year for them is maybe 1/20th of all the time they've been on the planet. That's significant. That is significant time that they're not going to get back in terms of their social interaction. And I think, throughout this, and I hope that we'll hear something about this from Valerie and Pat as well, but there are at-risk subpopulations in all these age groups. When you talk about closing schools, there are children with special needs that they can't remote learn. They can't flip open their laptop or their iPad and learn the same way they were learning in a special education classroom. And it's not just the academics they're missing out on, it's the social services, it's the occupational therapy, it's the physical therapy, it's the speech therapy. And we have those at-risk populations at every age. And so it is really a ripple effect. And I think, Deb, I mean, you know this better than anyone, the term second pandemic in terms of mental health consequences was being used right off the bat as soon as this pandemic started.
Well, Val, that brings me to you. I think that Dr. Brunnquell and Dr. Ashton laid the table as to what the issues are. How on a state level are we dealing with this? How are we looking at this? I think the second pandemic is a very good characterization of what's going on in people's lives.
Well, first, I just want to say good morning. And, you know, it's nice to see everyone, even if it is virtual. Last year, Deb, when you asked me to participate on a panel for the Breakfast Club to discuss mental health, I certainly thought it was an important and relevant topic. But almost a year later, who would have known how relevant it truly is? You know, COVID has given us a new normal. It's changed our entire vocabulary, self-quarantine, social distancing. And I just want to say, you know, Governor Murphy constantly says, there's no economic health without public health. I want to add that there is no public health without mental health. And so what we are trying to do on a state level, we are really making strides. But I just want to go to Bergen County for a second before we go to the state. You know, Bergen County has 70 municipalities, as you know, and 69 of the 70 municipalities have taken action to declare their towns to be stigma-free. And this designation certainly sparks a conversation in our communities about mental health. And another shout out to Fort Lee High School, if I may, because they have done groundbreaking work through the Born This Way Foundation. They are one of 35 schools nationwide, one of 35 nationwide, Fort Lee High School, to participate and educate students about mental illness and how they can identify and respond to peers and loved ones struggling with mental health. So with that being said, I think they deserve our support, and I think we should be proud that we have this high school in Bergen County. But let me just quickly go to what the state government is doing. Last year, Governor Murphy signed landmark legislation, the New Jersey Mental Health Parity Act, which ensures that health insurers provide coverage for mental health services and substance use disorders under the same terms as provided for any other sickness. And I think this was critical legislation to ensure access to mental health. And as we mentioned, you know, COVID-19 has posed countless challenges for mental health. So I want to just say that as chair of the Aging and Senior Services Committee, I have seen the long-term care facilities, especially nursing homes, where residents often are experiencing isolation and loneliness. So when the state first shut down in March, obviously I've received many phone calls and emails about families who had loved ones in nursing homes. And due to concern of, you know, the spread of COVID, visitation, as you know, was severely restricted, leaving our seniors without any means to connect with children, their grandchildren, their spouses, or their loved ones. So I introduced legislation, which thankfully the governor has just signed into law in August, that would require facilities to have technology and personnel in place to help residents connect with their loved ones. And I think this was a critical step in protecting mental health of our seniors, not only during COVID-19, but any other future emergencies where visitation may be restricted or limited. So the Murphy administration obviously is doing the best they can under the circumstances. As you heard, I was telling Jen, there are naysayers in the state. Unfortunately, they say this is a scandemic. And when I hear that, you know, I think all of us has seen firsthand the effects of this. And in my professional life, I am a licensed funeral director. And I will tell you, I never want to go through what we have experienced with families in April and May. So this is real, and we need to take action, and we need to have really support from our community. And it's not political, it's not partisan, it affects all of us.
Well said. Dr. Brunnquell, we're talking about solution and how we're addressing mental health crisis in our community. Englewood Health, 2 or 3 years ago, established the Shadek Center for Behavioral Care, the Gregory P. Shadek Center for Behavioral Care under your leadership. You want to talk a little bit about what that is and how we're addressing these issues?
Sure. So you're right. The story actually goes back several years pre-pandemic. And it starts with the concept of population health. So the medical system is moving towards this concept of population health, which essentially means that a system like Englewood cares for a population of people, its community. And has been said before, just a few minutes ago, you can't establish people's physical health unless you address the mental health, the behavioral health component. Dr. Ashton and I know very, very well that you can't separate the two. That a lot of the things that I see in the office, and I'm an internist by trade, is a product of what people are going through. So a few years ago, we approached Warren Geller and the board and said, we need to do this. The access has become very, very difficult because commercial payers just don't reimburse mental health professionals the way they ought to. So even though we have great psychiatrists and psychotherapists in our community, by and large, they don't take insurance at all. So to eliminate that barrier to access, I propose that we hire our own. And we hired 2 psychiatrists, a psychiatric nurse practitioner, and 7 licensed clinical social workers to do psychotherapy. And as only you can do at a nonprofit, I said, here's the business plan. It's going to lose money. We're going to lose $500,000, $600,000, $700,000 a year, but we need to do it because it's the right thing to do for our community. And thanks be to God, Warren bought it. He brought it to our board. The board said, okay, we all agree. This is something we need to do. I can remember, Debra, you may have heard this story, that a newspaper reporter called me after he caught wind of this and said, I can't believe what you're doing. And he said, I did my own little survey. I called 20 psychiatrists. 18 took no insurance at all, and 2 were booked out for 6 months. So needless to say, it was an instant success. Everybody was booked. And along came my friends, Pat and Larry Shadek, who, and I won't steal Pat's thunder. I'll let her talk about her sponsorship of the center. But it's a crucial part of what we do. We are currently recruiting more psychiatrists. We're currently recruiting more licensed clinical social workers. And if I can take advantage of the fact of we have an influential politician on the call today, we hire the licensed clinical social workers, and I can't get them on the insurance company panel because the insurance company tells me we have too many already. And yet we have weeks. You have to wait weeks for an appointment. We're not going to solve that today. But it is, I think the introduction of the mental health professionals in our network was timely, and it's been a great success.
And that brings us to Pat Shadek. Pat and Larry Shadek have helped bridge that gap in leading. Pat is the chair of the advisory council for the center, and they are philanthropists who are leading the discussion at Englewood Health related to funding this particular program. Pat, what motivated you? Where did you come to this? We can't hear you. You're on mute. You're still on mute. There you
Thank
go.
you. Sorry.
It's okay.
No, first of all, thank you very much, everybody, for having me come to speak. And, I must say, Dr. Brunnquell has always been a motivator for me, that's for starters, but I cannot tell you how much this center has done for the community. Englewood Health and the center have not, what's so wonderful is they have not turned their backs. They have not turned people away. The insurance gets so much access to care. And the fact that I very clearly know that people are suffering, and I knew this way before we lost our dear son, but I have always been interested in, or not even interested, just amazed at how much people suffer and the vulnerabilities that people face every single day. So the center has beautifully stepped up, and they are doing so much, not only for the community, but as was referenced before, they're doing many interventions for the staff who need it desperately, because being on the front lines is no easy task, and they're so to be admired. And the center has just filled that need, as well as continued to be booked, seeing people with mental issues and people with substance abuse. So that actually alleviating suffering and is what motivates me every day, because I think that that's what we're here for, is to help others. But what I would like to say is to Englewood, blessed are the merciful, for they will receive mercy. And I can't say enough about the center. I mean, they have so many programs with the youth, addressing stigma, just incredible reach out to the community. They have liaisons that are just bringing this all together. So it's not hard to find that motivation, and for Larry and myself.
Thanks,
Not to
Pat.
mention my son, but we could talk about that if there's time.
Dr. Ashton, what resources, if you had to choose one resource that you see a gap in service or in access, what would that be for mental health at the crisis and for our patients?
Well, I think that we've heard some of the issues, as Dr. Brunnquell said, the reason that mental health professionals, first of all, there are only 500,000 licensed mental health professionals in the entire country. So try to wrap your mind around that one for a second. Then you talk about how little insurance companies value that work. By the way, no differently than they value preventative care in general. It's why doctors more and more are not taking insurance. They literally can't afford to. And when you talk about mental health, I think that we need a paradigm shift in this country about the fact that if you can't see something, it must not be that serious. I think destigmatizing this as an illness or working to bolster it as a preventative health and wellness positive outcome is fantastic. But at the end of the day, it needs a good PR campaign. When someone has heart disease or someone has cancer, they immediately get the circles rallied around them, support, big glamorous fundraisers with lots of celebrities, and that doesn't really happen for mental illness. And it's whispered about, and it's looked at as a weakness or a failure or a limitation. So I think that needs to change. I think that on the part of the medical community, this is very difficult, and I understand it's also a Pandora's box and a slippery slope, but we have to start asking the tough questions. And a lot of doctors which I totally understand, don't like to ask questions if they know the answer is something that they can't help to fix. That goes contrary to why we became healers. And a lot of time, what people are struggling with mental illness need is they need someone to listen to them. And if you're not getting paid for that by the insurance company and you don't know what to say, because by the way, in medical school, we're taught how to screen for someone who may be suicidal, but then we're not taught what to do when they say, yeah, I actually am thinking of killing myself. You know, and so we need a complete overhaul from our standpoint inside the medical community. And then I think societally, we also need work. We need to understand that it's not a weakness in ourselves to ask for help, that not every help comes in a prescription pad, that sometimes it is a medication, but sometimes it's, you know, talk therapy. And the one bright spot of this pandemic, I think, actually, I think there are probably many opportunities always within any crisis, but one of them is, you know, the rapid augmentation and implementation of telemedicine, and a lot of mental health counseling can lend itself to that. Not all, and I have spoken to many mental health professionals who say that it's challenging and doesn't always work for every patient. Of course not. Nothing is one size fits all, but certainly the access has been augmented considerably in the setting of the pandemic with telemedicine. But I think that it really starts by awareness. And I mentioned before, thinking of things by age group. That's one of the filters I use in medicine and in reporting medical news, but I also use that filter in life. And I think that, when we are raising children as parents, we teach them, if the house is on fire, call 911 and here's your address. And we teach them that at a very, very early age. I think that we should teach children at a very, very early age. If you or someone is having suicidal thoughts, here's the number, 1-800-273-TALK. You can memorize a lot of things. You can memorize that number. You can be taught to look out for the signs of depression or what to do if someone shares with you that they're struggling and they're in a dark place. And so that also starts in school. That starts, with better education, but it also starts at home. And it starts with our language, with the conversations that we have with our children, and with each other. And when Rob, the man I was married to for 22 years, a thoracic surgeon, died by suicide 4 years ago, it was out of the blue. It completely shattered our world. And within 24 hours, my children and I, who were 17 and 18 at the time, were sitting in a therapist's office on a Sunday. And we agreed that therapy would be part of the rest of our lives, no differently than if someone said, you have a cancer genetic mutation, you're at high risk for cancer, so you're going to need certain surveillance and behavioral modification. And I think that that's the way we need to start looking at mental health and mental illness. And that gives us a lot of targets. So again, I'm kind of a glasses half full type of person. So there are a lot of things that we can start doing today. And a lot of the 52 attendees right now listening, many of whom already do a lot of these things, can start doing today. And everyone who watches this can start doing these things, even if it's one thing. And I think that's where you start with one step.
Yeah.
I
just want to follow up on the telehealth, if I may, just very quickly. The Murphy administration has worked to identify opportunities in telehealth to support broader access. And so we are trying to waive copays for telehealth therapy appointments. And I think that's something to be mentioned because I think telehealth is very important today.
Bless you. That's a great idea. Thank you. Deb,
I have a lot of great ideas, Doctor. We just need to get support for them.
If I can just share with Dr. Ashton and the attendees, actually for about 3 years or so now, every office visit in the Englewood Health Physician Network begins with 2 questions about depression. The medical assistant asks 2 screening questions about depression, no matter why you're in the office. And what it does is it breaks the ice. I remember a big strapping Mason was in to see me one day, and he was reflecting on those questions, and he said, you know what? Yeah, I am depressed. And yes, it opened the door and it allowed him to talk to me about that, and we hooked him up with some help.
You know, and just to follow up on the psychiatrist, doctor, both of you mentioned the lack of psychiatrists in New Jersey. And I also have just a public announcement message from a piece of legislation that I am working on, and that's to expand New Jersey's tuition reimbursement program for child psychiatrists who work with the Department of Children and Families.
That's
so
great.
I think we need to incentivize psychiatrists and all mental health
That's great.
professionals.
Bravo.
I just want to get my couple of
That's
good
great.
ideas out there to get
Thank you.
support. Thank you.
Okay, we have a couple of questions from our audience. The first is best suggestions for dealing with the rise of anxiety in teens in the school setting. Pat, you want to? I know that you've been working in that space a little bit.
I think with everything, and the term, I think it was Dr. Brunnquell talked about population health. And Dr. Ashton talked about the across the lifespan, the different groups. But I think a lot of it is that it's just exactly like acknowledging it. If you're in the school system, or if you know teens and you think, trusting your instincts. Like if you think someone's suffering or they're anxious or is to reach out. Don't turn your back and say, oh, someone might deal with that. I mean, because you never know where that will trickle. You never know where that will go. And once you get the younger people, the teens and young 20s and stuff to talk, they have a lot to say. They have a lot to say. And it's just walking beside them, meeting them where they are, and, working with them to know that there is light and there's, ways to cope. So I think, I always default to the substance abuse portion of mental health, and the alienation, and with COVID, it so concerns me because, again, people with substance abuse can't even, their biggest thing is to get their drugs, and how can they actually reach out? And so my message really is just reach out. Don't be afraid, because we just don't know.
Dr. Brunnquell, did you want to address that?
Yeah, thanks, Deb. So I think we should first all acknowledge that everyone is anxious. 100% of us have a degree of anxiety. There is an emotional impact on everyone, me included. It's everyone, for all the reasons that have been stated already. The one thing I would say, if I had teenagers in my house right now, is listen to them. Not just the words, listen to what's behind the words. Allow them to talk, as Pat just said. And even acknowledge your own anxiety with them. And then go through some of the things that we can positively do for ourselves to cope with the anxiety. We're not going to be able to eliminate it, but we can develop coping mechanisms. And these are important to work on, because most of the coping mechanisms that we've all enjoyed, traveling, going out with friends, going to the gym, going to a movie, going to a show, those have all been taken away from us. So we all have to consciously develop a sort of a new set of coping skills.
Okay, we have two questions that really focus on access, insurance coverage, how to get a young person. One of our participants has a daughter who is on Medicaid and does not have access, cannot find a therapist. And I know that the answer to that, Dr. Brunnquell, is that we will certainly get her connected with the Shadek Center.
We can certainly do that.
Yeah.
One of the things actually the state of New Jersey does pretty well is some mental health resources. And actually, before we opened the Shadek Center, the only game in town, if you couldn't afford a private psychiatrist, was the 4 centers in Bergen County. Most of us go to the one in Dumont, and actually there's some very good people there. And there's both psychiatrists and psychotherapists, and that's sort of the mental health, the behavioral health safety net. And I wouldn't hesitate to use those people. I've had very good experiences with them.
Okay, we have a couple of minutes left. I'm going to ask
Another resource for the county, though, we have Newbridge, the Newbridge Hospital,
Right.
Which certainly in partnership, whether they're addictive, addiction, abuse or services, mental health, it covers a realm of challenges. So that's another resource for the county if anyone's living in the county.
Yeah, I think we have 3 minutes left. I am going to ask for, and we can go over a little bit, some just closing remarks. Dr. Ashton, we'll start with you.
Well, I'll keep them brief because on the air, if I speak more than 20 seconds, I get cut off.
I'm going to cut you off, Dr. Ashton.
But, my final thoughts really on this issue are that I think we all have resilience, psychological resilience, mental resilience, and physical resilience that we may surprise us at times. We have it as individuals, and we have it as a community, and we have it as a society. And I think that in the darkest times, which everyone will go through, it's really important to remember that you're not alone, that a situation is temporary, and that really all we have, any of us, is today. It's the now. And so a lot of people spend a lot of time generating a lot of anxiety and sadness, thinking either about the past or the future. One of those things is gone, and one of those things is not in our control. So that leaves only the now. And I think if you focus on, what's going on right now, anyone can find resilience that is there. I have seen it, I have felt it, and I believe in it.
Thank you. Val?
Thanks, Deb. I just want to give a shout out to our frontline healthcare workers because, many of us have had signs in the windows during the pandemic to thank them, but we really have to put our money where our signs are. And I'm proud that New Jersey has signed a couple of pieces of legislation to, give them some hazard pay and give them their minimum wage, whether they're doctors, nurses, dietary workers, aides. We need to thank them because they certainly have put their own health and safety before ours. Many of us have been in the comfort of our own homes, and we need to really appreciate everyone that's out there that has been working out on the front lines. And so I think I want to give a shout out to them. Just in closing, we've got a few dark months ahead of us, and I think we can meet these challenges. And I think we're all going to be more resilient. And I really think that we will be in a good place in 2021. And it's really the efforts of everyone really on this panel. Jen, you've become a superstar. And I mean that, we've been friends for a long time, but I appreciate all you have done for us. Deb, you've really been instrumental in gathering us together for a wonderful breakfast again. I'm the only one, I think, that continue to have coffee through this breakfast, but I think it's good. But listen, it's great. I think when we're connected virtually and we see each other, it's a lift to all of us. So everybody stay safe, stay healthy, and happy holidays and healthy holidays.
I'm going to go to Pat. Do you want to close out?
So I just find that whenever there is adversity, and there, if one can work on all the things that you spoken about so beautifully, that there's not much you can promise, but if you stick through the adversity and you remain open and you remain as positive as you can, that there are blessings. There are definite blessings, and there is, like what I like to say is there's like some cream with cherries at the other side. So I thank all of you from the bottom of my heart for all that everybody's doing on so many levels. Dr. Ashton, Dr. Brunnquell, Valerie, I know your title. I'm sorry, I'm not 100% sure, but anyway, I just think that this is not easy, but it will end. It will end.
And Dr. Brunnquell, our leader.
Thanks, Deb. And thanks for the opportunity today. I think what I just like to share is, yeah, I agree with the resilience. We are all capable of doing actually much more than we think we can, and we will get through this. But to do that, I think you need to take care of yourself, right? It's that acknowledgement of the anxiety. I don't know a lot of people who are sleeping through the night these days, but how can we take care of ourselves? We can get outside whenever the weather is conducive. We can figure out a new way to exercise without going to the gym. We can read novels. We can pursue a hobby. I've actually suggested to people, because we're not laughing very much these days. Have you noticed that? We don't laugh. I've actually encouraged people to watch reruns of I Love Lucy and MASH and shows like that, because it's an escape for 30 minutes, and it's a healthy one. And lastly, to reach out to people. We are inherently social beings. And that's one of the things that hurts us the most right now, is we can't connect the way we'd like to with our friends and our family and even our coworkers. So reach out, text someone, call someone, see them at a distance outside, go take a walk with them, maybe even write a letter. You remember what those are, right? You sort of write a card, you put a stamp on the outside. Our kids don't know what that is, but people like that. And it's the connection that we all crave. And by doing that, you'll actually help yourself too.
Okay. I'm going to echo all of this, particularly what Val said, is be healthy, be resilient. And I want to remind everybody that Englewood Health is your hospital, your health system. We're here for you every day, 24/7. So what you need, please come to us. We'll be there for you. If you want to help us in this, certainly call my office. We're very happy to get you involved because there's plenty to do and to help each other. So be with us, be well, and thank you very much. Thank you, Val. Thank you, Dr. Ashton, Dr. Brunnquell, and Pat. Be well.